Thank you, Dr. Muhammad, and welcome, my dear colleagues in Fellowship of Vascular and Endovascular Surgery, the Egyptian Fellowship. Is the voice okay, Dr. Muhammad? Okay. Well, actually, this lecture I've been preparing for it for a long time, and you can call it my idea of passing the Egyptian Fellowship of Vascular and Endovascular Surgery exam. When I got the first ranking of this exam, actually, I want to give you or to deliver the message of how can you not just pass the exam, also to get one of the best top ranking of this exam. My name is Ayman Elsir. I'm a Palestinian consultant of vascular and endovascular surgery. I would like to, first of all, to talk about the trinity of success. In anything in life, if you want to success in this fellowship exam, you have to get three things: the knowledge, the skills, and the spirit, or some people call it the abilities. Some people call it the KSA model. The knowledge comes with education. It's the theoretical part you need to get about this exam. The theoretical part about vascular surgery. The skills is how to apply this knowledge in specific situations. So it needs a lot of practice. The third part is really important. The abilities. It's different from a candidate to another candidate. And really this can make some difference. Having or acquiring the critical way of thinking, the intellectual way of communication with people, with colleagues, with everybody, as I'm going to discuss. And of course, the talent that God gives you. So the three things, if you can acquire, I can say more than 90% of every one of these, you can get the first ranking as I get. If you can acquire more than 60% of all the three of these, I can guarantee that you can pass the exam. Knowledge is extremely important. And I have the honor to have a certificate in how to teach students. And they were always teaching us that there is a model called the air conditioning model or the fridge model. Whenever there is an input, which is the electricity, and then the output, which is the low temperature that these devices can give, and then there is the feedback, which is the thermostat. I mean, when there is cold or the door of the fridge is open and things became warmer, the fridge itself moves forward and forward to make the atmosphere colder inside. The same applies to AC. The same applies to model of teaching and the model of knowledge acquiring. The input is what will let vascular surgery goes to your brain. The output is what you can show that you know the knowledge of vascular surgery. It's not separable, the feedback, which you have to adjust the input and output accordingly. Let's go into specific more details. So just to summarize, we are talking about the first part of the trinity of success, which is knowledge. Input in vascular surgery. This slide shows few words, but each word behind it a lot of work, a lot of information. The syllabus or the curriculum. First of all, you need to put in front of your eyes what is the curriculum of what the specialty you are studying about. Here is vascular surgery. The inputs, the materials you need. You can call it the armamentarium, these inputs. Books and electronic books as well are quite important. Get out of the books and think out of the books. Mobile applications, social media, webinars are really important, as I'm going to discuss in details. Not just going to the classic model of the student or the candidate. You have to go outside, go to conferences, local conferences, attend international conferences, attend workshops. You have to be active, actually. It's extremely important to be attached to one or two or more mentors who can teach you. And the important nomenclature of shadowing them is extremely important. Talking about the syllabus or the curriculum. In vascular surgery, we have two things, general things and vascular things, or going to the specialty that you have to be examined, to have the exam about. In general, we have topics that at least in when you need to pass the exam, you need to read about these things. You have to know about the pathology of atherosclerosis that you will face in many topics, like ischemia and upper limb, lower limb ischemia, aneurysms. You need to know about the pathology, how this atherosclerosis came from. You need to read about ICU. Acidosis is extremely important in reperfusion injury. Acidosis is important in bleeding. Acidosis is important in delayed ischemia. It's paramount to know about antibiotics. You have a station called diabetic foot, for example. You should know that diabetic foot is polymicrobial. However, some cases are mixed with ischemia. You need to choose an antibiotic which is less nephrotoxic. And believe me, when you read about the syllabus, always put something like uh, one sheet of paper that describes all the topic. So when you read a book talking about atherosclerosis in, for example, 10 pages, you should summarize it in one or half a page. It's really important. Grafts, neointimal hyperplasia, radiology, MRI principles, contrast, and I will tell you from where did I study. So these are general topics, but they are very equally important like the specific topics. When we talk about the vascular itself, you will see topics about radiology, aorta, venous, lower limb ischemia, upper limb, and compression. In fellowship and the Egyptian fellowship exam, they ask a lot about the TOS, thoracic outlet syndrome, lymphatic axis, and there's endovascular, operative, diabetic, visceral, and renal. I'll give you my tips in these things. Whenever you have an exam, try to know about the mode of the exam, how it will go through. When you have topics, you should read about these topics. You can study about these topics as I'm going to tell you at the summary slide, how to approach these things. But at the beginning, we have 5 years of vascular surgery, 2 years of general, and I'm talking about the 3 vascular years. Studying this syllabus starts from the 3rd year, which means not just before the exam. What I assume that you are studying from the beginning in order to get the first ranking. The materials or the books I really advise to study from are vast. There are many books, but I've chosen, look at the second book, which is the Rutherford. This is the best book actually I've read from, and it's updated now. There is the 10th edition. You can easily download it if you want to study it from a digital library. And try to make a summary, because do not expect that 1 month before the exam you will read Rutherford again. No, you should have a summary from what you have read through the 3 years, and this summary is out of, let's say, 50 or 100 pages only. These 100 pages are like the best input you can get from the syllabus. There are anatomical exposures. It's important because part of the exam is operative. There are clinical scenarios like MCQs and talking about cases. It's very important in the third and the second part actually. A beautiful book of Wesley Moore that discusses in a comprehensive review. It's like a summary of Rutherford. However, the beautiful questions they have at the end of each chapter are really marvelous, especially when you read the explanation. Atlas of the vascular therapy and endovascular therapy, when you really need to know some images, especially when your experience is less about this topic. So, going back to inputs, the social media, there are free and very nice web pages that you really can find things like vascular online training by Dr. Muhammad Al-Sharif. It's really important. You have many videos, free videos. It's more than videos. You have advices. You have announcement about workshops and conferences. There is the Vascular Society of Education and Training Committee giving some free webinars. They are very important. Vascupedia, which have been formed by a group of Greek vascular surgeons, and it's really something like a Wikipedia for vascular. It's very important. The Venn Foundation for venous things, led by many eminent venous surgeons and angiologists. The Case Discussion Group, which is a WhatsApp group, free group, contains many vascular surgeons around the Arabs and Middle East. And they are expanding, actually. They present real cases, consultant talking about their cases. They are having multiple opinions. And this is the what's so-called discussion. Discussion means not believing in one opinion. Read about many opinions. And at the end, you can hear the best therapy and the results. And if there is a complication, they are discussing these complications in a very professional way. I really advise to follow these groups. I really advise, and as I told you, I'm going to give you my tips, or you can call it Ayman's tips for passing this exam. One of the things is to have a digital library. When you go for this exam, you have to have a good laptop, and you have a good internet connection, and to have the digital library of you. This is one of my digital libraries. Try to collect all the guidelines in one file, all the guidelines. They are free in a PDF form. And then try to have files about the exam, previous exams, questions, third previous exams. Try to read them. When you have, let's say, to tidy up, to be haphazard in studying. Try to make a file for everything. You can make it also like a file for the syllabus itself. So having your own digital library is very important, and not just downloading these things and forget about them. Whenever you read these things at least once, you will have a knowledge. I'm not telling you to repeatedly read these things. I'll tell you about funny things we did actually in the third exam. In my group, the people we entered the exam together, we made a WhatsApp group. This is called, and we name it a funny group name like Harafish. We had really fun out of studying in a group. This group contains about 25 candidates together. They're studying together. One of them presenting a book. The other one is presenting an exam. And whenever we have a group study, I've initiated this actually, and we have done something like a Google Drive containing all the topics we read together. Listen, my friends, try to get out of the box, which is undergraduate student thinking of that we have to compete with each other. I should study alone. And no, as a tip, postgraduate study is very different than undergraduate. Whenever you hear from your colleague, he will add an information to you. Whenever you study more, this will activate all senses of studying. You are reading loudly to others, so this is the reading. You are listening to them, so you are activating another sense of hearing. You are watching what they are studying, and we are using multiple platforms like Zoom and Google Meet and things. They can draw to discuss for others. They can draw the surgery itself in this group. So you are activating your eyes as well. And you are turning the pages, you are activating your hands. Whenever you activate, and they are teaching this in how to teach students, when you activate many senses, you will have more stability in fixing the information in your brain. My tips also will include the local workshops and local conferences. You are lucky for having or being in Egypt. Egyptian conferences, local conferences, they are vast, and they are going through like 6 or 7 conferences per year. And this is very nice. You have conferences talking about Venus, an IMAC talking about the aorta. They are gathering many international people. And the EF and the EVC and the EVS always doing some, and the universities, they are doing many conferences in their universities in many places. You will gather with your mentors, you will meet your examiners as well, and you will learn from them. And there are many things beside these conferences. Try to apply in the workshops. They are very beautiful, actually. They present simulators for aortic mapping, or aortic graft sizing. There are workshops for how to do VAC dressing. There are workshops about how to know some theoretical information about your topics. Look, really, when you are active going there and everywhere, you will have the ability to pass this exam very easily. Attending one international conference per year is of paramount importance. Not important to go in person, however, though this is very useful. You can attend these conferences like online. You might pay for attending online or traveling there. It will enlighten your information and the knowledge part of your education extremely. There are these symposium, the live in Greece, the pairs and the AVC and the link and the AVF and the Charing Cross, of course. And the beautiful things that they are not together. Each one has a specific month of the year and you can attend them. It's really important to have at least once per year of these things. Okay, when I talked about the model of input, output, and feedback, all these causes the input of your knowledge part of the trinity of success. Output is to have your frequent exams during the year. And here, I really remember the dearest Dr. Ahmed Saaduddin. We really are sorry for his loss. We lost him, actually, the consultant of vascular surgery, Dr. Ahmed Saaduddin, in Sahel Hospital. He was doing many frequent exams during the study, in addition to Professor Rashad Bashara and Dr. Omar Al-Farouk as well. These will let you have the output of your study, actually. Either to have them in place, like the place you are doing your fellowship training, or you can do these output exams for yourself, like solving one of the models, previous models, or like the books that I told you about, solving these questions and examining yourself. This is considered kind of output during the whole 3 years. You can get your feedback. Always ask your mentors, how do you think I'm progressing? Am I doing well? And a beautiful thing about the Egyptian fellowship models of trainers, that the trainees, they know their trainers in each facility they are trained in. So you can ask them. It's not a secret. If they are giving feedback about you, you should ask about this feedback. Tell them, what do you think am I deficient at? They will tell you, for example, the venous part, the ultrasound part, the aortic part. Always make a communication with your trainer. So this is the knowledge part. I think we can move now to the second part, which is called the skills, which means applying the whole knowledge in specific situations. The skills is about your hands, about your eyes, about your brain. How do you think? How do you elaborate in performing surgeries? Because at the end of the day, we are surgeons. We have to treat people in our hands, actually. We know that we have open and endo part in vascular, open vascular surgery and endovascular surgery. These two books are of extremely importance, especially the first book called Endovascular Skills by Peter Schneider. And it has the recent edition. It's very simple. It's very nice. You can read it from the scratch. It will teach you everything about endovascular principles and skills. And for the open, we have many books. I recommend this Mastery of Surgery book, and you can read it as well. So do everything. Learn from many people. Duplex skill. The very beautiful thing that I liked about my experience in Egyptian fellowship is that they really are keen about the duplex and ultrasound skills. Dr. Wasila Taha, I really owe her a lot of training in this part. And in duplex ultrasound, it's very important. Believe me, when I finished the fellowship and I'm working as a consultant, I'm using ultrasound like a stethoscope in everything, in diagnosis, in therapeutic intervention, in post-therapeutic interventions follow-up as well. So try to hold the probe as much as possible. Try to connect to the radiologist if this ultrasound it belongs to the radiology department. However, what I believe that all the Egyptian vascular centers containing ultrasound belonging to vascular surgeons. Try to grab the buttons, press the buttons, know the color, the pulse wave, the different moods, see the patients in the afternoon, look at your carotid cases in the afternoon, go to cardiac surgeons department when they ask for a consultation about pre-CABG carotid exam. Go and look at their carotid. You will find many things about velocities, about significant or insignificant stenosis. Not only the ultrasound, also emergency vascular surgeries, as I said. Spend a lot of time during attending these bloody surgeries, embolectomy, open AAA, open femoral embolectomy, which comes a lot. Try to ask, if you are a young trainer, try to ask for doing things. I really liked my juniors when they are pressing and asking, and they want to learn, they want to do things. And I believe that if you are just silent and not talking, nobody will give you anything in vascular surgery. You really have to ask for things. Try to learn how do they use their fingers. Look at this image. It should not happen, actually, throwing blood at your colleagues. You should have proper hand skills and how to use your hands and instruments in stopping bleeding. Another thing which is of quite important, improving your skill, sampling and lines insertion. Go to the nephrology department, ask them if you needed permicath, I will insert it for you. If you needed ultrasound, go to the ICU. They are happy because they put many central lines in the hospital, and they wish someone can come and take off part of their work. Inserting central lines, even inserting cannula ultrasound guided, will increase your skills. These are my tips for the skills, actually. So shadowing, choosing the mentors, doing these skills is extremely important to improve your hand skills. And you will be asked in the exam about these skills. And the smart examiner will know, actually, if you have good skills or not, because the thing that is not there in the Egyptian vascular exam, which is examining the hand skills. And however, they will know if you are good in skills or not, and you will have either plus marks or minus marks if you have abilities in doing skills, or you are deficient in these skills. Simulators, if you have these simulators, is very important, especially in aortic surgery. It will keep you updated, and we have in my training in Qasr Al Aini, and all thanking to all my professors there, we have this simulator which shows how to go through wires and how to go through aneurysms, how to pass a lesion in peripheral ischemia, how to do sizing. If you don't have it in your training facility, you will have these simulators in workshop. And I've seen Dr. Muhammad Al Farouk always with the Siemens and many companies of aortic simulators. You can learn a lot of these simulators, actually. Please remember this thing. Never learn skills from a single school, as I've said. Learn it from multiple schools. This will give you a vast skills experience, actually. Let's go to the spirit or abilities. Believe in God. We should believe in God. Should be attached to God. and think that everything happens is that God gives you this for your sake. Even if you did not pass the exam, you should believe in God, that God wants you to be a good surgeon. God wants you to be better and to increase your skills and experience and abilities. Explant the idea of competition in postgrad. Yes, you have to compete. However, believe me, I did not run for being the first ranking on my fellowship, but I've worked harder and harder, and I got it. And I told you the group study is of paramount importance. And I remember some days I'm really bored of studying. When we have an announcement that today at 7 p.m. we have to go to this group, and I found everybody's in this group, this will let me forget about being bored and talking to them and go through this group of study. And we have done something very beautiful. Every meeting has a different leader. So leadership or leading the meeting is extremely important. You can really do this. Of course, eating and drinking and you have a good health is very important, especially when you have an exam coming very soon. The extracurricular activities as well. The last thing is very important, communication skills with your colleagues, with your older colleagues as mentors, and also with your younger colleagues. What I really have seen in the hospitals is that the senior dealing badly with the juniors. No, the senior should look and take care of the junior, training them perfectly and deliver what he knows to them so they can help them in the future actually. Learn from nurses. I learned cannulation from nurses actually. They have a lot of information. Don't treat them as they are working for you. No, they help you a lot and they know many things and many skills as well. Companies, it's extremely important, believe me. Talking to companies, especially in workshops and conferences, is very important. Actually, they can give you a lot of things, a lot of information about, especially in endovascular, they will tell you what does some nomenclature means actually. Radial force, the deliverability of these balloon catheter, the self-expanding stent, the balloon expanding stent. They will explain it to you like you have never seen before because they have the material. They can show you the stent out of the sheath. You can feel it. You can feel it. You can know that this venous stent is very flexible. It's not like a stainless steel stent. You can know these things by approaching to these companies. The OT staff. I've been attached to many institutes of endovascular. At the beginning, they will let you at the end of the table. So you will talk to the OT staff. He will tell you or she will tell you about the contrast, how they dilute the contrast. What's the meaning of the loading heparin dose? How do you flush cannula? How do you flush catheters? So you really have to know from these guys a lot of information, and then you will be upgraded. You will be the second assistant, the first assistant, and then you will do the surgery by yourself. So it's important to know from these OT staff. They know the names of the tools and instruments more than you, so learn from them. The anesthetist. And during the surgery, talk to the anesthetist and not just looking at the field. Always keep an eye looking at the monitor. When there is declamping, off-clamp, reperfusion injury, talk to them. Of course, they know their job, but you have to ask about this in your career in order to learn, especially in this exam. Administrative things, it's very important. How to write notes, how to be decent in writing notes in a very beautiful way about every patient you have seen. You have to have a small notebook with you. This is kind of administrative tidy up. Okay, so we have finished now the three trinity of success, and let's go to the just coming weeks before the exam. Whenever you have these three things in your brain, everything will be easy later on. We have a pre-exam preparation. We have part 2 exam in October every year and part 3, which is the final exam on January, I think, or December. For part two, which is the MCQ exam, you need to read a lot. Whenever you read a lot, you will find this information coming in the exam and you will select it A, B, or C, or D, or whatever. Collect previous exam. Answer a lot of MCQs. Do you remember when I told you about the digital library? This is where you can find these MCQs. And don't wait until the previous weeks of exam to collect these exams. No, during the whole year, just collect them and put them in your digital library. And at the end, you will come with a cup of coffee and solving these exams. Never think there is a trick. Yes, the exams is a part of assessing you. They are not in meaning to dehumiliate you. No, they want to see you are a safe surgeon or not. So the information will come, you will solve it yes or no, A, B, C, or D. Think smart, read well, what gives you more marks. So think smart and read well. For the final exam, you have to put in your mind some important things. You should know how the exam will go through. Ask previous colleagues who ran through this exam. It's actually a written and oral. The written is typically like the second exam. However, you need to read more, to read a lot. Oral is a result of all the three trinity of success all over all 3 years of study. So in oral, the examiner will find or will assess the final product of you. Try to be presentable. Don't be shy. Don't be sweaty. Just be presentable and be smart. Wear a good tuxedo and have a good shape. These really, believe me, if there are no marks about it, they will give you marks about these things. Don't rush in answers. They are giving you their time. And the beautiful thing about the Egyptian fellowship exam, it's really timed, which is you should know the time of your station. If it's 20 minutes, you should answer a quiet, sharp answer, fixing or just to the point. Do not go through introduction, talking blah, blah, blah. Things are not useful. He's telling you, tell me about the guidelines in significant carotid surgery. Go, carotid stenosis. Go straight forward to the answer. And don't talk about atherosclerosis in carotid. For example, don't waste time because this will not give you extra marks, okay? Because there are many other stations. Radiology is a unique station for fellowship, as I told you, which makes it very important and very lovely exam. Radiology, they care about the CT, how to read CT angiographies, how to look at pathologies in lower limb ischemia, CT angiography, MRIs, duplex. They will show you pictures of duplex scan, pseudoaneurysms. So it's very important, as I told you in the preparation. Be firm with tough examiners. Yes, we know there are tough examiners in any exam in the world, and they are well known. Tough examiners, you just need to be firm. Take them seriously and not lightly. I mean, you have to answer sharply, go to the straightforward, you know what they are looking for, and just give them the answer, okay? Don't waste time, actually. And whenever they are tough with you a little bit, just forget about that and never look back. It's very important in the third station, never look back. Because you have to know the stations. In my exam, we had 16 stations, and you need not to fail in 2 stations. I mean, 6 out of 10 was a very good chance for you. You need to know these. Maybe they are changeable every year. How to pass these steps. So you have to know about your stations. Be fluent, speak in English, talk evidence, always talk evidence. Because whenever you are evidence-based answering, nobody will tell you anything because you have the evidence of your answer. Never say, in my experience. What's your experience? You're a student, even if you have an experience. We are all learning. And whenever we go in further post-grad and different European and exams, we never say, in my experience, okay? Never say, we do it in this way, and you insist on doing it in this way, because this will irritate the examiner, actually. As I told you, you learn skills from multiple mentors. However, in the exam, you read and you answer what you are believing in evidently based. So the evidence says you do like this, and don't say, we do it in this way. what you have done it in this way in your facility will increase the skills part of your hands. However, it might be not correct. So in exam, be very careful in saying these things. Finally, my final advice: success in the Egyptian Fellowship Vascular and Endovascular Surgery is a result of your overall achieving the trinity of success. So these three things in success: knowledge, abilities, and skills will give you, as I told, the final product, which is passing the exam, and not just passing. Believe me, if you have done all these three things, I will guarantee for you, all of you will take the first ranking of this exam. Thank you very much, and I hope wish you all the best wishes in your exam, and you will pass this exam easily. Like what you are studying, believe me, when you pass it, you will feel relieved. So just do an X-ray for these days. And please pray for Gaza. In these days, we know what's happening there. During your exam, yes, you are studying, but never forget to pray for Gaza. Thank you very much, everybody. Thank you.